Wisdom teeth. Most of us have them, and many of us need to have them removed. So what's up with those pesky extra teeth? Do they always have to be taken out? Well, here with a lesson in Wisdom Teeth 101 is Dr. Mario Velarde, president and publisher of Dear Doctor Dentistry and Oral Health. Dr. Velarde, great to see you again. Thanks for being here.
It's my pleasure.
So first, tell us a little bit about wisdom teeth. They're sort of mysterious for a lot of people because they pop up so late in life, and we're not quite sure what we should be doing with them.
Well, that actually is how they got their name. The fact that you get them late in life, and you know, from old cultures, it was the people, the leaders of their community that got wisdom teeth at 17 to 25 years of age when they were accruing wisdom. So that's how they got their name.
And so that's really when they start to pop up, is around 17 or 18?
17 to 25 years of age is the time frame.
And does everyone get wisdom teeth?
Well, most everyone gets wisdom teeth. Actually, through evolution, our jaws and our head are actually becoming smaller, more refined, and there's less room for them. And through many, many years of having to remove them, it seems that some people are being born without them today. It's
interesting because, looking at myself, I only had one wisdom tooth pop up. Is that common, that people only have one or two?
Not really.
No?
Not
okay.
really, but that's good in some ways.
So some people don't have all four.
Right, and 4 is the magic number you're supposed to have. They're actually your third molars.
Okay.
And if they have room and they can come into the mouth, they can be perfectly healthy, functioning teeth for the rest of your life.
So as long as they don't give you any problems, you can leave them there.
Well, that's the problem, actually. They often don't cause pain or symptoms that a person can know that they're actually causing problems, and yet they cause problems.
What kinds of problems?
Well, periodontal disease is a number one issue. If they're impacted, which means they're surrounded by bone or a combination of bone and gum tissue, they can be in a certain angle compromising the bone support of the second molar. And thereby, with bacteria in the mouth, as you get older, the gum disease can lose the bone support for the second molar and compromise an important tooth.
So your dentist will be able to tell you if this is happening, because you won't feel it yourself.
You need that examination.
Absolutely. Now, is there any truth to the thought that the wisdom teeth will come in and cause your other teeth to shift and move?
Well, that's an old wives' tale that a lot of dentists believe because we don't really have any scientific evidence as to whether or not that's true. But the thought is that the wisdom tooth doesn't have any special power that it moves all the other teeth into a crowded position. So I would tend to say that that's not really true, that you shouldn't have your wisdom teeth removed because you think that's going to prevent crowding of your other teeth.
So only remove it if it's causing problems.
Yeah, and that's why you need the exam, because you don't have symptoms often.
But the wisdom tooth is one of those sort of strange things which occasionally pop up in the body which really don't serve a purpose. Is that right?
Well, they would serve a purpose if there was room for them. That's why it's important for the dentist to actually evaluate whether or not you have room, whether the teeth are coming into proper position. But if they're going to be horizontal or crooked and they can cause more harm than good, that's when we have to remove them. So
what would the purpose be if they don't cause harm? Just extra molars?
Extra bite support, extra support of your jaw for your lower third of the face. They can be very important teeth and perform all the functions that your other posterior teeth do.
But do they perform some special function because they come later in life?
Nope.
Are they compensating for something that happens as we get older? No?
No, not really.
All right, interesting. No. So tell us about what people should know if they do have to get their wisdom teeth removed, because this can be kind of scary.
That's an important question to ask. Actually, you want to get them out if you need to have them out early in life, before the roots get really long. You know, people don't think about the fact that they're erupting into the mouth, but the roots are not fully formed at 17. So if they're going to be needed to be removed, it's easier to remove them earlier. Second, if you leave them in, as the roots develop, they can get closer to the nerve in the lower jaw. They can also have cyst formation. So there are problems that can develop that are not related to causing pain. So that's why you need the examination routinely through your life to make sure that that's not an issue.
So even if your wisdom teeth are causing you no problems whatsoever for the first 5 years, they could start to cause problems later on.
That's right.
All right. Well, that doesn't make me feel very good, because my wisdom tooth has been fine up to now. I guess I have to get it checked out. Now, if you do continue to get it checked out, though, and it's fine, there's no reason you might ever have to remove your wisdom tooth.
That's true.
Right. Okay. So you could have a wisdom tooth for the rest of your life.
I have all my wisdom teeth.
You have all four?
Yes. Yes.
Fantastic. So is there anything else you should tell people to keep them kind of reassured before going in to get their wisdom teeth removed?
Well,
it can be painful.
That's you want to address that. You want to, if you have your wisdom teeth removed, you want to actually surround your face with ice. 5 minutes on, 5 minutes off, so you minimize swelling. It's really the swelling that causes most of the pressure that results in pain. So you want to, take care of yourself. The day you have your wisdom teeth removed, you want to basically have ice applied all day long so you don't get swelling.
And have somebody baby you and bring you soon.
Yeah.
Right?
All
right. Dr. Velarde, thank you so much. And for more of Dr. Velarde's advice, be sure to check out Dear Doctor magazine. And you can always visit the health page at abcnews.com for the latest medical news.